Okay. Hello everyone. I am Nimish. My membership number is S21002, and I am here to speak upon the prevalence and prognostic significance of retinal findings in pediatric cerebral malaria cases at a tertiary care center. So, malaria is a parasitic disease caused by Plasmodium species, and cerebral malaria is one of its complications caused by Plasmodium falciparum. And the classical definition of cerebral malaria is that it is peripheral parasitemia with coma, not due to any other identifiable cause like convulsions or hypoglycemia. But this definition misclassifies cerebral malaria in up to 25% cases as determined by histopathological examination. Malarial retinopathy are the retinal signs of cerebral malaria, and these include retinal whitening, vessel discoloration, retinal hemorrhages, and papilledema. Malarial retinopathy helps us to distinguish between the histopathologically confirmed cases and those cases which meet the broad clinical definition but actually have other cause of death. The presence of retinal signs are also associated with poorer prognosis. So our study aims to find out the prevalence of these retinal signs in pediatric cerebral malaria cases and to find if there is any correlation of these signs with the final outcome of the disease. So all the cerebral malaria cases admitted in the pediatric department of our institute between June 2016 to September 2017 were included in our study, and the diagnostic criteria was acute febrile encephalopathy, either with peripheral smear or rapid diagnostic test positive for malaria. The patients were pharmacologically dilated, and detailed fundus examination was done using direct and indirect ophthalmoscopy. Retinal signs, if present, were documented. The patients were then treated for malaria, and a meticulous follow-up was done to find out the final disease outcome, which was also documented. The outcomes were categorized as recovery with neurological sequelae, and death. A correlation with the presence of retinal signs and these outcomes were determined. Any change in retinal signs over the period of time was also documented during the follow-up. The data was analyzed using SPSS software for Windows, and appropriate univariate bivariate analysis were done. P-value of less than 0.05 was considered significant. So a total of 100 patients were included in the study. 48 of them were boys, 52 were girls, and the mean age was 8.4 years. And the average interval of fundus examination from admission was around 4.6 hours. So from this chart, we can see that almost half of the patients, that is 48 out of 100 patients, had signs of retinopathy in my study. And these are the various fundus pictures that we took of the patients. As we can see, all the signs present over here: retinal whitening, white dot hemorrhages, and even we can see papilledema. So out of 100 patients, 74 survived while 26 died during the treatment. Out of the survivors, 64 recovered fully while 10 had neurological sequelae. And out of those who could not survive, 20 had signs of malarial retinopathy while 6 had normal fundus. So this chart compares the presence of retinal signs with the mortality in the patients. So we can see that the presence of any signs of retinopathy has a statistically significant association with mortality. And among the various specific signs, papilledema, hemorrhages, and vessel changes have statistically significant association with mortality. So this finding was also confirmed on multivariate logistic regression, and the signs of retinopathy resolved completely after discharge in all the patients. This study has shown that retinal changes has significantly poor outcome in cerebral malaria cases, and the presence of retinal signs in my study has been shown to be in lesser number of patients as compared to those reported in literature. And the mortality rate associated with retinopathy in our study is higher than those reported in the previous studies. Even the mortality associated with retinal hemorrhages has been shown to be higher in our study as compared to the previous studies. A small sample size and absence of comparator group are the lacunae of these studies. And so we can conclude that ocular examination by direct or indirect ophthalmoscopy is of immense importance in cerebral malaria cases, and presence and severity of retinal signs are significant predictors of prolonged coma and death. So the findings of our study are consistent with the hypothesis that retinal changes in cerebral malaria relate to cerebral pathophysiological processes, and retinal features are an integral part of the clinical picture, and ophthalmic observations can contribute to continuing studies of pathophysiological processes and therapeutic interventions. It will be important to assess the extent to which general practitioners in malarial areas can identify some or all of the changes described. These are my references. Thank you.